I think somewhere in the latter part of 2003, I started prescribing the Suboxone. When a family has been in need in the past, the two people they usually go to are the minister and their family doctor. As a primary care physician, am I restricted in what I do for my patient? Am I restricted to treating their diabetes, or am I restricted to treating their hypertension? I treat their depression all the time. Why should I not then treat this problem?
We begin tonight with a local breaking news alert in northern Kentucky.
Kentucky's heroin problem is not a narcotics agents broke
because
up a
northern
major
Kentucky
heroin
is the
ring.
epicenter of heroin abuse.
How I discovered heroin was where I was at in my life at the time. The way I felt about myself. I just graduated high school, had a girlfriend that just left me, my football career and dreams were over with. I think it's just life was crashing down onto me. And the only thing that made me get outside of myself, made me feel better about life, was heroin.
Opportunity met desire for me. You know, I really didn't want to do heroin because that's what my sisters have died from.
I wound up in his garage, snorting it off his dryer. And I don't know, something happened. It just proceeded to be almost an everyday thing right after that. There was no hope, I felt like. It was happening, whether I liked it or not.
There were 5 overdoses in Owen County. That's a very sparsely populated county in 1 week. You multiply that times the 8 counties, we're talking at minimum 40 overdoses a week. And 2 of those in Owen County were fatal.
So are you taking 2 of the lower dose and 1 of the upper, or are you taking 1 and 1?
1 and 2.
Okay. If I give an individual Suboxone, the universal response is that, gee whiz, I feel normal again. Suboxone is basically a synthetic opioid, but you don't get the euphoric effects. So people can block their urges to take the opioid without getting euphoric side effects, which makes it almost a fail-safe type of treatment.
They need to do something with that for real.
Sorry, we seem to lost Kay. Everybody have a seat, folks. Good morning. Ivy here. Steve, my
I personally feel that when you're talking about Suboxone and methadone, you're talking about replacing one opioid for another. With heroin, you have to keep it a level just to feel decent. It's not even feeling high anymore, it's just to feel okay. And so when you detox someone in a jail facility, you're not giving them any treatment, you're not giving them any course of conduct to overcome the cravings, you're just housing and detoxing basically. And I've talked to more than one heroin addict that's told me the same thing, that the memory of how difficult detoxing was one of the things that actually got them through not using again. Now, to get to that point is pretty hard. You know, when I started this all those years ago, they would tell me between 7 and 10, somewhere in there, attempts at sobriety before it sticks, and now it's closer to 10 to 15. It sounds terrible, but I don't give them a choice. I mean, this is the structure that I'm comfortable with. It's one I know that works.
From a coroner's perspective, I look at relapses, only they're in the form of a death certificate. And we have a considerable number of those on a monthly basis. If I have a patient base of 100, over a 6-month period of time, I will probably have a dropout rate of about 8% and compliance rate of 92%.
We're going to pay, for a lifetime of Suboxone and methadone under Medicare. I don't know. It seems to me that you just don't treat the problem then. You're just masking it with another source. So.
Is this the same judge that was giving us hell about even taking the Suboxone?
Yeah.
And what was his stick? I forgot what his beef was.
Their mom told the judge basically like he's on Suboxone. For some reason she thinks it makes me not wake up with him in the night, and that was her concern. Now every time we go they argue that I'm still on it. I've had to this and that, just like jump through hula hoops to see my own kids, all because she's blaming Suboxone for a side effect that's not even there, and the judge basically has bought into it.
Okay, so what's her attorney's name? The problem that I see is this lack of being more open-minded to the medical treatment of the problem. We're not contributing to the addiction. What we're giving people is a light at the end of the tunnel. If I have urges once I leave a treatment program, these urges could potentially kill me. So if I have a medication that can reduce those urges and allow a person to participate in life normally, what's wrong with that?
There's so much dope in all Cincinnati. It's so easily and readily just to get.
Once I hit the city and found out you can get twice as much for, and that's twice as good, it was done.
It made me do things I never thought I'd have done before in my life. It made me scheme 24/7.
I didn't care if I was gonna hit your grandma or, you know what I'm saying? It didn't matter. I'm gonna get my means to get high for that day. I wrote bad checks. Stripping houses of copper.
I'll rob, steal, anything I had to do to get it. It really made me a person I never thought I'd be.
We are an abstinence-based recovery center. We work through a curriculum that was designed around a 12-step program, and that particular 12-step program addresses alcohol. And we're dealing with an entire generation of young people that may not have necessarily been a drinker. It's hard to keep the attention of somebody who didn't have an alcohol problem. And unfortunately, I can only assume, but I assume that we're not as effective with these kids that are addicted to heroin. With any crisis situation, you want to deal with the most critical component of that. Right now, that is the death in Northern Kentucky. We're losing a generation of people to overdose. I feel that a medically assisted treatment model can stabilize that epidemic. And I believe that Suboxone provides that. It provides the time necessary to foster relationships within the recovery community, to foster relationships with family, be able to perform as an employee, as a mother, father. It gives someone the time needed without the extremely dangerous and uncomfortable withdrawals when you stop using heroin.
We have the girl who was in a program. She's out for a week and then she's deceased in the lavatory of a local gas station. The common comment that I see from parents, oh, gee whiz, they seem to be doing so well. Well means, what does that mean? They look good, but you don't know what well means. You cannot change all these factors in 30 days. You can try to reprogram an individual, but that's in a confined environment, It's like saying, well, we're going to go to basic training, but then we're going to go out and we're going to fire real bullets at you and see what you're going to do with them.
With this disease, it truly is a matter of life and death, and there's a sense of urgency about getting people the help they need when they need it. And Casey's my son, who died at the age of 23 from a heroin overdose. I think that for some folks with opiate addiction, Suboxone can give people a leg up in treatment. Not that it's the only answer, but it can be part of the answer to recovering from opiate addiction. I only wish that it had been available when Casey was in crisis.
The patients who come to my office come because they have no place else to go. They universally have social and economic problems. A half a gram of heroin on the street is anywhere between $60 and $80. The average heroin addict does, you know, they say 20, 40, 60, but most of the patients I see are doing a half a gram a day. $60 a day times 30 days, you can do the math between the cost of my office and the cost of the medication. And sometimes it's free if they have Medicaid or health insurance. They're all of a sudden economically in a better position. So there's first base. Now you have to deal with the issues that precipitated the usage. So what else is going on? How's work treating you?
Pretty good.
What about our dose? What do you think? We always have sessions in my office. I end up being a life coach for these people. We communicate about how their quality of lives have improved. And how's the Luvox working out?
Pretty good. I think it's working.
Okay. You take it at night?
Yeah.
All right. I'm not going to have them walk in the room and say, hey, how you doing today? How much do you want today? Here's your strips, see you later. No, the patient has to come back and report back to me. There's a certain responsibility that they have to me as the patient. And physicians have to take that step, but it's a big step.
I was locked up for 6 months. It seems like every time I called, one of my friends died. Probably about 7, 8 of them just in a 6-month span.
I lost about close to 10 friends just last year in heroin overdoses, and that always gave me an excuse to keep using.
There's probably 20, 25 people out of my 600-person class that have OD'd in the last 3 years. And that number's growing every day.